In order to be prosecuted, convicted, or punished, a person in the criminal justice system has to be competent to answer the allegations against him.
The Washoe County Sheriff's Office Jail-Based Mental Health Unit is designed to treat the mental health population that has been identified by the courts as needing additional treatment in order to continue on with their court proceedings.
It's a more focused mental health program for a very acute population of individuals that come through our facility that oftentimes are our high users of mental health. That means they're either in our facility or they're in our hospitals or they're on our streets.
The system has too many people in it and not enough beds. So there aren't enough available places for people to be housed at lakes. And as a consequence, people whose competency becomes questioned end up on a waiting list to go from the jail to lakes. Lakes is a secure facility, like a jail-based setting, not a jail, but it is secure. And there's a waiting list, and so people end up languishing for weeks or months, waiting simply to go from the jail to lakes where they can get restoration to competency. And the jail-based treatment program front loads that.
Because they're already receiving therapeutic treatment and have become medication compliant, when they are at Lakes Crossing, their time there can be less.
The average length of stay if somebody goes to Lakes Crossing because they're not competent is 120 days. Well, if we can reduce how long people spend at lakes because their treatment and education begins before they get to lakes, we have more beds available at lakes. So the wait list, the impaction, if you will, to get into lakes can be relieved or reduced.
We have a specifically contracted team through NAFCARE that provide the jail-based therapy program.
The intention of the program is to have folks return to the community quicker and healthier.
The idea behind this unit is that these individuals in here, they've been identified by the court as specifically needing this treatment, and without that treatment, they have a high likelihood of regressing, getting worse, possibly not improving at all, which will increase the amount of time that they have to stay here just simply because they don't understand what's going on. So within this particular unit, there's a lot of programming, a lot of organized programming that goes on.
The treatment program includes several kinds of psychoeducation and skills-based groups. These are groups like emotion regulation, anger management, distress tolerance, and relaxation skills. We're teaching about hygiene and self-care. We're teaching about interpersonal effectiveness, communication. These skills are what the patients are going to use to better understand their mental illness and be able to go on with their lives and their legal cases.
Do you want to come out for chair time for a little bit, or you want to hang out in here?
Day one with the housing unit being open, there's a lot of trust and faith in the abilities that the deputies have, the NAFCARE, all the efforts that went into this, that we allowed those individuals the opportunity to commingle with one another. They will eat together during certain meals throughout the day. They'll come out to tier time and socialize with one another. There isn't such a level of segregation in this unit because of the amount of treatment that's being provided to them. And when I say treatment, it's not necessarily just on the medical side. It's the amount of observation time, the interactions with the deputies. The deputies are very in tune with what the pulse of the unit is happening, but also they're observing the individuals.
It is essential when you're working with patients with severe mental illness, such as schizophrenia, spectrum disorder, bipolar disorder, delusion and mood disorders, that you develop a trusting relationship.
Nice. 15.
We're building a relationship with each individual in the unit, and a good foundation of any relationship is going to be trust, and to help earn that trust and be more of a peer to them and not an authoritative figure within the unit. We will sit down with them at their programs where when that first started happening, they were more standoffish, wondered why we're right there next to them. Where now they're more comfortable with it. They call us in to participate with them in these groups.
When you have this trusting relationship with your patient, the clinical team, it's easier for them to start to kind of gently challenge some of these delusions or misinterpretations they're having, which allows for the patient to build insight into their mental illness, do their own reality testing, and have a better self-awareness of what they're experiencing.
No, you go first.
The deputies are a crucial part of the patient's care team.
One of the things that the deputies do is they utilize an app that was created by the research and development team here at the Washoe County Sheriff's Office to collect data and information on each one of the individuals that's housed in this unit.
They know the inmates in their housing unit, but now they're trained to watch their hygiene, track their socialization, track their medication, track how much they're eating, how much they're sleeping.
The data that we receive from the deputies is crucial. They are with the patients day in and day out. It is a designated team that is assigned here to the unit. So the deputies understand the patients. They understand their personalities. They notice when there's behavioral changes, a change in their sleeping habits or what they're eating or how often they're socializing. And that data they bring to the weekly treatment teams as a part of the patient's care team. We use that data to guide our treatment planning and what might be best for the patient.
I am very proud of this unit, the work we've done so far. I look forward to all the work we're going to continue to do in the future. We have a great team of deputies every shift, and they all love being in here, love working with these guys.
Patients are becoming more medication compliant and more involved in their therapeutic interventions, such as attending their psychiatric appointments, attending their clinical appointments, engaged in the programming. 96% of our patients have been prescribed medication for the first time since they were in jail, have become medication compliant, or at least partially compliant. 80% of our patients have shown significant improvements in their engagement in the programming, again, attending their therapeutic appointments, psychiatric appointments. And this matters because the more that they are engaged in the programming, the healthier they're becoming, ideally reducing their length of stay at Lakes Crossing Center or becoming stabilized enough so that when they do go to Lakes Crossings, they're not there very long, or they can return to the community and seek their treatment in an outpatient setting.
There's a lot of resources that are being utilized in this unit to ensure we're giving these individuals with extreme mental health conditions every chance that we can give them to get better so they're not wrapped up in the justice system.
I have 3 goals for the jail-based mental health unit, both long and short term. First one's making a difference in that acute population where we provide them program services so they don't keep using our healthcare system and our criminal justice system. 2, the training that those deputies and clinicians are receiving, spreading it throughout the office because it only makes us better as a profession. And 3, looking at possibly ways we can alter the law and collaborate with the state so that that funding mechanism that currently goes to Lakes Crossing can help fund at the local levels these mental health units so that we can help Lakes Crossing as a force multiplier addressing that acute population.
I would say to my colleagues in the legislature in particular, either spend the money here or spend 4, 5, 6, or 10 times as much money downstream. If we continue to have a system where we just forget about people who have mental health issues, particularly if it affects their competency, and if we make them worse every time they get arrested through the competency process, we guarantee more arrests, more jail bed days, more prison bed days, and much, much, much more money. And so funding a program like this is smart spending, and it saves money everywhere in the system downstream. At the end, we want a healthier, safer community. If we address people's mental health issues, they're less likely to commit crimes. We get a healthier, safer community.